Respected unit officer Haridas sir, and all my dearest colleagues sitting here, there, and everywhere in front of me. Today it's my turn to take a class as part of CME, and the topic is dengue fever. As far as the diseases, as far as the disease types are concerned, dengue fever is a very familiar topic. Each one of you sitting in front of me are actually capable of taking a class at least for 5 minutes, even if you are not prepared, because it is such a familiar topic. In my opinion, not a single day of us passes by without mentioning something about dengue fever in the office or in the field or wherever we are, or in the group, in our WhatsApp group also. We will every day we will check whether there is any dengue cases reported in our group, or our file area inspectors posted any post in our WhatsApp group or not. So, my dear friends, I don't think it's necessary to take a detailed class or an elaborated class about dengue fever. So, my dear colleagues, without any further ado, let's straight away dive into the topic. Dengue fever actually is a viral fever caused by flavivirus and is spread to people through the bite of an infected Aedes species female mosquito. When an Aedes species female mosquito bites someone who is infected, then first this mosquito becomes infected. When that mosquito bites someone else, he can get this disease. So, my dear friends, once the flavivirus is in our body, it will take 2 to 7 days that we start feeling sick. That is the incubation period. So, its incubation period is considered to be between 2 to 7 days, and only after this period, the infected person begins to show the symptoms of this disease. The symptoms of this disease can be seen in two different ways. And some people it will be mild like a bad flu, but in some other people it will be really serious. The initial symptoms of dengue fever often include a slight headache and tiredness, quickly followed by the onset of fever, muscle pain, and joint pain. However, in some people it can be really serious. See, it can be more severe, especially during a second infection. See, in such case, this individual might experience intense abdominal pain, vomiting 4 or 5 times a day, bleeding from the nose or gums, and this time the patient might be hospitalized immediately, or else it can be fatal. So, next, there are a few basic tests that you can perform in the dengue virus detection, but it is the timing of this disease that is more important. And my dear friends, why I am saying so is it will take at least 3 to 4 days for the antibodies to appear against the antigen. So in the initial 3 to 4 days, the antibody will be negative, but the patient will be having infection. This time, the test which we need to detect dengue fever is NS1 antigen test, because it takes almost 3 to 4 days for the antibodies to appear against the antigen. But remember, after 7 days, the NS1 antigen test should not be done, because by that time, the antibodies must have developed very well in the patient's body. Then you can perform other tests like IgM and IgG to detect dengue fever. These are two actually different classes of antibodies produced by our immune system. IgM antibodies are the first type produced by our immune system in response to a new infection like dengue. My difference, their presence typically indicates the recent infection. Actually, IgM stands for immunoglobulin M. And next it is IgG. See, IgG antibodies appear later and provide a long-term immunity. Their presence usually indicates a past infection. So once the IgG antibodies are positive, that means the patient must have a past infection, because IgG antibodies are the second type of antibodies produced by our immune system. So that's all about dengue fever symptoms, diagnosis, something like that. Then next it is the control measures, and it will be presented by our Wilfred sir, because he is actually well prepared and he is here in front of us. He will take a detailed class about control measures, how to control this dengue fever, and what are the activities we have to take in order to prevent this dengue virus. There are we can perform different kinds of control measures like fogging, spraying, biological control, chemical control. See, so it will be explained by Wilfred sir. He is actually present here and he is eagerly waiting to take the class because he is well prepared. So, if you have any doubts in connection with the topic or the part which I have mentioned already, you can ask me this time, or else let me stop for the time being. Thank you very much. So this class will be continued with Wilfred sir, and he will explain all about control measures of dengue fever.